Hi, I'm Avery. We are Group 3 for the Head and Neck School Project. Today we're going to be presenting bones 1 through 68, and I'm going to start us off by presenting bones 1 through 16. For the first bone, we have the occipital bone. This forms the posterior and base of the skull while protecting the brain. For bone number 2, we have the parietal bones, which are paired. These form the superior and lateral sides of the skull, providing protection for the brain. They articulate with each other at the sagittal suture and with surrounding cranial bones to help maintain the shape and structural integrity of the cranium. For bone number 3, we have the facial bones, which form the framework of the face and support structures such as the eyes, nose, and mouth. They also help protect sensory organs and provide attachment points for muscles involved in facial expression and chewing. For bone number 4, we have the parietal bones, which form the superior and lateral walls of the cranium. They articulate with the frontal, temporal, sphenoid, and occipital bones, contributing to the rigid structure of the skull. For bone number 5, we have the sphenoid bone, which is a central cranial bone that forms part of the base of the skull and helps hold all other cranial bones together. Bone number 6 is the ethmoid bone, which is a lightweight cranial bone that forms part of the anterior cranial floor and the roof of the nasal cavity. Bone 7 is the maxilla, which forms the upper jaw and makes up the anterior portion of the hard palate. It supports the upper teeth, and it also contributes to the floor of the orbits, the sides of the nasal cavity, and it helps shape the midface. Bone number 8 is the zygomatic bones, which form the prominence of the cheek and contribute to the lateral wall and floor of the orbit. It also articulates with the temporal bone to form the zygomatic arch and helps strengthen the facial skeleton. Bone number 9 is the lacrimal bone, which is a small, thin facial bone that forms part of the medial wall of the orbit. It contains the lacrimal fossa as well. Bone number 10 is the nasal bones, which form the bridge of the nose and support the upper portion of the nasal cavity. They articulate with the frontal bone and the maxilla to provide structure and shape to the nose. Bone number 11 is the palatine bones, which form the posterior part of the hard palate and contribute to the floors of the nasal cavity. They also help form part of the orbits and the lateral walls of the nasal cavity, supporting the structure of the midface. Bone number 12 is the vomer, which is a thin, flat facial bone that forms the inferior portion of the nasal septum. It divides the nasal cavity into right and left sides and articulates with the ethmoid and maxillary bones. Bone number 13 is the inferior nasal conchae, and it is a paired facial bone that forms part of the lateral walls of the nasal cavity. Bone number 14 is the mandible, and this is the largest and strongest facial bone, forming the lower jaw and housing the lower teeth. It articulates with the temporal bone at the TMJ, allowing movement for chewing and speaking. Bone number 15 is the hyoid bone, which is a U-shaped bone located in the anterior of the neck that does not articulate with any other bones. It serves as structural support for the tongue and helps maintain the position of the larynx and the pharynx. 16A and 16B are the thyroid and cricoid cartilages, which are major components of the larynx that form rigid framework to keep the airway open. The thyroid cartilage protects the vocal cords, while the cricoid cartilage provides structural support as the only complete ring around the trachea.
Hi, I'm Courtney. I'm going to be going through numbers 17 through 32 for the first part of our school project. First up, we have number 17, the articular fossa. The articular fossa is located on the temporal bone and forms the socket of the TMJ. It allows the mandible to articulate and move during chewing and speaking. Next up, we have number 18, the pterygopalatine fossa. The pterygopalatine fossa is a small deep space located behind the maxilla. It serves as an important passageway for nerves and blood vessels connecting the nasal cavity, orbit, and oral cavity. Next up, we have number 19, the infratemporal fossa. This fossa is located below the zygomatic arch, and it contains muscles of mastication and important nerves involved in chewing. Next up, we have number 20. Number 20 is the temporal fossa, which is a shallow depression on the side of the skull. This houses the temporalis muscle, which helps elevate the mandible. Next up, we have number 21. Number 21 is the pterygoid fossa, which is formed by the medial and lateral pterygoid plates of the sphenoid bone. It contains muscles that assist with chewing movements. Next up, we have number 22, the canine fossa. The canine fossa is a depression on the anterior surface of the maxilla. This serves as a muscle attachment site for facial expression muscles. Next up, we have number 23, the coronal suture. The coronal suture connects the frontal bone to the parietal bones. It runs side to side across the top of the skull. Number 24 is another suture called the sagittal suture. The sagittal suture runs down the midline of the skull. It joins the two parietal bones together. Number 25 is the lambdoidal suture. The lambdoidal suture connects the parietal bones to the occipital bones, and it is located at the posterior portion of the skull. Number 26 is the squamosal suture. The squamosal suture connects the temporal bone to the parietal bone, and it is found on the lateral side of the skull. Next up, we have number 27. Number 27 is the median palatine suture, and this suture runs along the midline of the hard palate. It joins the two maxillary bones together. Number 28 is the transverse palatine suture, which separates the maxilla from the palatine bones. It runs horizontally across the hard palate. Number 29 is the temporozygomatic suture. This suture connects the temporal bone to the zygomatic bone, and it contributes to the formation of the cheek area. Here we have number 30, the glabella. The glabella is a smooth area between the eyebrows, and it is used as an important anatomical landmark. Here on the underside of the skull, we have the pharyngeal tubercle. The pharyngeal tubercle is located on the inferior surface of the occipital bone. It serves as an attachment point for pharyngeal muscles. Last but not least, number 32 is the hamulus. The hamulus is a hook-shaped projection on the phoenoid bone, and it acts as a pulley for a muscle involved in swallowing.
My name is Kelsey, and I'll be covering numbers 33 through 48 of our school project. Number 33 is kind of tricky to see, but it's the spine of the sphenoid bone, which is a sharp projection on the sphenoid bone that serves as an attachment site for ligaments located near the foramen spinosum. Number 34 is this rounded projection of the temporal bone located behind the ear that also serves as an attachment for neck muscles. It's called the mastoid process. Number 35 is right next door, and it's the styloid process, a slender pointed projection of the temporal bone that anchors muscles and ligaments of the tongue and throat. Number 36 has two parts, A and B, the superior and inferior nuchal line. They're curved ridges on the occipital bone that also provide attachment for neck and head muscles. Number 37 is right next door. It's the external occipital protuberance, which is a midline projection on the occipital bone where ligaments and neck muscles attach. Number 38 is pointing to this large foramen here, which is the carotid canal. It's an opening in the temporal bone that allows for the internal carotid artery to enter the skull and supply the brain. Number 39 is the foramen ovale, which is an oval opening of the sphenoid bone that transmits the mandibular branch of the trigeminal nerve. Number 40 is the foramen lacerum, which is an opening at the base of the skull that is mostly filled with cartilage and allows for small nerves and vessels to pass through. Number 41 is this small foramen spinosum, which is an opening in the sphenoid bone that transmits the middle meningeal artery and vein. Number 42 is the stylomastoid foramen, which is an opening between the styloid and mastoid processes, which through the facial nerve exits the skull. Number 43 is best seen from the interior view, which is the jugular foramen. It's a large opening between the temporal and occipital bone that allows for the jugular vein and cranial nerves to pass through. Number 44 is hard to miss. It's the foramen magnum. It's a large opening in the occipital bone through which the spinal cord connects the brain. Number 45 is also easier to be seen from the interior. It's the hypoglossal canal and foramen. It's an opening in the occipital bone that transmits the hypoglossal nerve, which controls tongue movement. Jumping all the way to the palate, it's 46, the incisive foramen, an opening in the anterior hard palate that allows nerves and blood vessels to pass through to the front teeth. Not far away is number 47, the greater palatine foramen, which is an opening in the hard palate that transmits the greater palatine nerve and blood vessels to the palate. Number 48 is this tinier posterior superior alveolar foramen, which is an opening in the maxilla that allows nerves and blood vessels to supply the upper teeth and the maxillary sinus.
I am Olivia, here's my skull, and I'm going to be going over numbers 49 through 64 of part 1 of the skull project. Number 49, the pterotympanic fissure is an opening in the temporal bone that connects the middle ear to the temporomandibular joint. Number 50 is the pterygoid canal, which is a bony passage in the sphenoid bone that acts as a passage for nerves, arteries, and veins connecting the middle cranial fossa to the pterygopalatine fossa. Number 51 is the olfactory foramina, which are tiny holes in the ethmoid bone's cribriform plate that allow olfactory nerve fibers to pass from the nasal cavity to the brain for the sense of smell. Number 52 is the optic canal and foramen, which allows the optic nerve and blood supply to connect to the eye. Here is another view of the optic canal and foramen. Number 53 is the superior orbital fissure, which is an opening between the greater and lesser wings of the sphenoid bone to allow for the passage of cranial nerves. Here is another view of the superior orbital fissure. Number 54 is the supraorbital fissure or notch, which is located above the eye socket in the frontal bone and acts as a passageway for the supraorbital nerve, artery, and vein. Number 55 is the foramen rotundum, which is an opening in the sphenoid bone that allows for the passage of the trigeminal nerve to the maxilla. Number 56 is the internal acoustic meatus, which is a bony passageway that allows for nerves, blood vessels, and arteries to enter to help facilitate hearing. Number 57 is the external acoustic meatus, which allows for the sound waves to enter the inner ear. Number 58 is the sphenopalatine foramen, which connects the pterygopalatine fossa to the posterior nasal cavity. Number 59 is the nasolacrimal foramen, which is a bony passage allowing tears and debris to drain from the eye. Number 60A is the infraorbital foramen, which is a passageway for nerves, veins, and blood vessels for the midfacial region. Number 60B is the infraorbital canal, which is a bony passageway that acts as a protected passageway for the infraorbital nerve, artery, and vein. 60C is the infraorbital groove, which is a shallow depression on the floor of the orbital surface of the maxilla. Number 61 is the inferior orbital fissure that connects the orbit to the pterygopalatine and infratemporal fossa. Number 62 is the pterygomaxillary fissure, which connects the infratemporal fossa with the pterygopalatine fossa. Number 63 is the mental foramen, which is an exit point for the mental nerve, artery, and vein from the mandible. Number 64 is the mandibular foramen, which allows the inferior alveolar nerve and blood vessels to enter the bone to supply blood to the lower teeth and gums.